Thank you, Laurel, and thank you, MBY Radio, for hosting this very important topic. And from the hospital's perspective, I'd like to think of the MB Hospital as one of the anchor institutions on this island. It was founded in 1921. And here we are 100 years later, we take care of everybody that comes to us 24/7, 365 days a year. We're also the largest employer on Martha's Vineyard. And as a business where our healthcare mission touches everyone, being able to recruit and retain talented and a stable workforce is mission critical to us. Finding housing for our year-round employees has always been a challenge, especially during the summer months. But now it's become the #1 impediment to recruitment and retention. With the housing market upended by the pandemic, the year-round population increasing and affordable housing, workforce housing bottoming out, we're headed for the perfect storm. With population growth and growing more rapidly in the greater than age 65 sector, so grows the demand for more healthcare. And to provide more healthcare, we need more people. It's that simple. Let me put this in context for you in terms of numbers. We currently have approximately 480 employees, including travel staff at the hospital in Windermere. And right now we have 98 vacancies or open positions, which includes nurses, certified nursing assistants, housekeepers, many technical positions, maintenance workers, people from every sector of the team that keep the clocks here running on time. This doesn't include physicians. During the month of January alone, 15 employees left us due to housing, and 19 employment offers were rejected due to housing. It takes us roughly 70 days from posting to filling a position, and our busiest months of the year are right around the corner. We are currently onboarding 17 travelers and have open requisitions of an additional 15 to round out our summer needs. You start to see the picture. Currently, the hospital maintains an inventory of about 90 bedrooms, mostly leased and a few owned, but it's just not enough to meet our current need. Purchasing a home for the average worker is nearly impossible and jeopardizes the stability of our workforce going forward into the future. Martha's Vineyard Hospital Windermere offers stable and good employment for many islanders and a growing number of those coming from the mainland to work here. The Martha's Vineyard Hospital median income is for annual earnings is at $81,000 a year, plus fringe benefits. The 2020 area median income in comparison is $64,000. To put this in perspective from a housing standpoint, a Martha's Vineyard Hospital median employee can afford a mortgage of about $400,000 and a monthly rent of $2,000. We all know what the published real estate data is showing us, that the median housing cost right now is 1.3, and the average rent is $2,900. Our housing expenses have increased, so our housing program that we have these 90 bedrooms was costing us about $2 million annually. We now have 30 less bedrooms and our costs are up to $3 million. Now I think you can see why I call it the perfect storm coming. We do have solutions, which is to build our own workforce housing and plans in the making. However, it just can't happen fast enough to meet the needs we have right now. To provide the best healthcare our community needs and deserves, we need great people. And people need affordable housing. It's indeed mission critical.